Thank y'all so much for joining us. I'm Melissa Bordelon, your president and CEO, and your person who's learning how to be tech savvy. I'm sure many of y'all are just like me, trying to dive in and learn how to do these things. We're so fortunate to have our friends from North Oaks Health System with us today. I'd like to just do a little housekeeping to start with. Please know that we are not going to have audio question and answers. We simply ask that you use the Q&A button at the bottom to submit any questions that you have. We will address those at the end after all three presenters have spoken. And if there's any questions that we don't get to, we will definitely pass those on to the team at North Oaks and get that information back to you. So I want to introduce you to our chairman, Rick Sedberry with Movement Mortgage, who is going to lead us through this. He is going to introduce each of our speakers, and then I'll come back and help with the question and answers at the end. So Rick Sedberry, thank you for your leadership, and I'll throw it your way.
Good afternoon, everyone. We're going to be introducing one speaker at a time. So first of all, thank you so much for making sure y'all came out today and participate. Up first, we have Dr. Robert Peltier. Dr. Robert is the Chief Medical Officer at North Oaks. In addition to his myriad of duties at the health system, he serves on the Louisiana Hospital Association's Research and Education Foundation Board of Trustees and is the LHA Physician Leadership Council. And additionally, he is chairing and facilitating a new LHA Chief Medical Officer Roundtable. He is also involved in leadership positions in his Chief Medical Officer Roundtable, a state organization for sharing best practices in healthcare trends. Dr. Peltier is a recognized healthcare subject matter expert. He readily gives his time to educate the community on hot topics in fulfillment of our mission of improving lives every time and every touch. He has become the local expert on COVID-19. He has been sharing his expertise with regular video and radio updates. And this October, he will be honored as the New Orleans City Business 2020 Healthcare Hero. So Dr. Robert, we're going to go ahead and turn it over to you and let you start us off. Thank you.
Thank you. I know we're going to have some slides up in a minute. First, I'd like to thank the Chamber for having us. We, like you, need to get our business up and running, and getting consumer confidence back up so that we can have people get back out in the community again is important, not only for your business, but for our business. And we have considerable concerns about the fact that patients have not started to come back to our facility or any facility, to be honest with you, in the state of Louisiana as it relates to taking care of all their health maintenance and even some of the elective surgeries that they have been putting off for a long period of time. And my point in having that discussion is I think we still have people that are very afraid of this particular illness. It certainly is concerning, but we are also concerned about their inability to keep up with things that may help keep them safe. So today we're going to have myself. I'm going to just give a short presentation, mainly on the numbers and helping you guys understand what you see as far as what the governor and his team at Louisiana Department of Health has been using to make their decisions. And then we have, some great experts here, which I'm sure they'll be introduced properly, but Jeff Jara, who is our HR director here, as our HR officer, he can give you a lot of information on employee health, what we're using to put people back to work and keep them safe. And maybe the most important person on this phone call is going to be Amanda. Amanda Morse is our infection prevention nurse. She's going to give you some practical tips on how to, ensure that social distancing is done well, especially, in your businesses, how to clean them, how to ensure that your customers come in and are safe throughout the process. Everybody has an interest in making sure that those patients, all the patients out there and people of our community stay safe. So with that being said, can we go to the first slide, please? So there's a couple of slides here. I just want to remind you the numbers of where we are. This is as of this morning off of the LDH and the Johns Hopkins website. You can see that, you know, worldwide, I think everybody started to get familiar with the vastness of these numbers. Tangipahoa Parish, we're down at the bottom there. We're at 665 and 23 deaths. Now, I pulled out all my information. I keep, you know, as many of you know, I've been on the radio most days, Monday through Friday with Johnny in the morning locally, but I kept track of my of all the numbers. And go to the next slide. You can see exactly 30 days ago what our numbers look like. So if you just look at Tangipahoa Parish, you know, we went from 171 up to the 665s, and our deaths have gone from 2 to 23. Now, you know, I know it's attributed to whether he said it or he paraphrased somebody else, Mark Twain's famous saying that there's lies, damn lies in statistics. All of these you have to take with a grain of salt. The deaths certainly fall much later in this disease. Most of our deaths are not occurring immediately when they get sick, but weeks and weeks later. And unfortunately, we've lost 23 of our people here. Next slide. You can see that in 1 month, this is how many, the multiplication factor we've had, both in cases and deaths. You know, worldwide, we've seen it, you know, go up just in the last 30 days, and mostly that's with other countries. As you can see, United States, we're at 3.5 times. Louisiana is at 2.3 times what they were. And in Tangipahoa, we're 3.8. We have been lucky here in Tangipahoa Parish. We have not seen the vast number of cases that we've seen to our every direction but north, I could say. St. Tammany Parish has a lot more numbers than we do, as does, obviously, everybody knows about New Orleans. Baton Rouge is the hottest area in the state right now. It is actually on an upslope, and we'll look at some of those slides in a second. Next slide, please. Here's the Region 9s. If you're the regions of Louisiana, if you're unfamiliar, we are Region 9, the North Shore, the 5 parishes in the dark blue at the top. Next slide, please. Here are some of the numbers from Louisiana Department of Health that were shared with me with Alex Bilyeu and Dr. Guidry on a phone call yesterday. You can see that influenza-like or COVID-like illnesses, so this is anybody comes into the emergency department with upper respiratory type symptoms that we suspect COVID, has steadily been declining. And these numbers only go through the April 24th, so they have continued to decline, and we know that from our numbers. Next slide. This is the graph that last week prompted the governor to push us another 2 weeks or another 15 days to May 15th. And this is the cases per capita per 100,000. And you can see that Region 9, we have plateaued and we continue to plateau there. And this is an epic curve, which is sort of a fancy graph where they average the 3 days prior so that you don't see some of the testing dates. We test a lot more here in Tangipahoa Parish. You know, we test on Monday, Wednesday, Friday a lot more than we do, and very few places are doing a lot of the outpatient testing on weekends. So this helps not have the peaks and valleys, but we can see that we're still plateauing. Now, the good news, next slide, is at least at the hospital, we continue to go down, along with some of the other regions, 1, 3, 4, 5, 7, and 9. We are on a down slope. So Region 9 is continuing. This is hospitalizations per capita continues to go down. Next slide. So this is a little bit more complex graph, and for those who've been listening on the radio, we've talked about the R0, or the basic reproductive rate. This is that little R with a 0, and a little bit complex, but essentially what you're looking at is the fact that this disease basic reproductive number is 2.4 when there is no social distancing. So 2.4 means that for every person that has it under normal circumstances, without any social distancing, without medications, vaccines, anything else, we would expect them to pass it on to 2.4 more people, and that's an exponential number. Where the Department of Health looks at these numbers, 1.7 is considered effective social distancing. 1.3, and you see that's that purple dotted line, is what they were hoping to get with a stay-at-home order, and what our actual number is much less than that. So anytime that we see a downsloping curve that R naught, or the basic reproductive number, is less than 1, which is important because that means if you could keep it there, we would eventually see the disease dissipate over time. So we're doing pretty well there, but unfortunately, we still have plateaued on the cases per capita. Next slide, please. I know a lot of you guys are going to have questions about testing and anticipating that. I want to let you know what was happening at North Oaks as far as testing. We have 3 ways, really 4 ways of doing testing here. 2 of them are in-house, where we have a machine that does a rapid test. So this is a PCR technology test. It's the nasal swab that you see. And we've always had a Cepheid test, which we've done our viral testing on. That takes about 45 minutes to turn around the test. The state did give us an Abbott machine, which has got a 15-minute turnaround time on it. The problem with both of those tests have been getting supplies to run it. Not only, the swabs have been an issue, but more importantly, the cassettes that go in the machines have been limited, and our supply chain logistics for that have been improving, and they certainly have got more steady, but not to the point where we are exclusively being able to use our rapidly turnaround testing. Most of the outpatient testing, therefore, we have done via send-out test through Quest Diagnostics. That turnaround time is 2.05 days on average over the past 2 weeks. So, most of the time when we're testing as an outpatient on Monday, Wednesday, Friday, and we're getting those tests back just in about 2 days, depending on which time, if they get it before our 3 o'clock deadline, where they pick it up and send it off to be tested. You've also heard a lot about antibody testing. We do have the ability to send some tests off to Quest. Right now, the couple that we've sent off have been a 3 to 4 day turnaround time. Unfortunately, it's for only one of the antibodies, and that's IgG. We are hoping that with our in-house testing, we'll be able to do IgG and IgM within the next couple of weeks. And remember, antibody testing is the test that we do to see if somebody has had the disease, has developed at least some semblance of immunity. We do not know at this time whether people that have gotten COVID, the antibodies that are formed will denote long-term immunity. Those studies have not been done. Next slide, please. At the end of that last slide, I'm sorry, before we went on, I forgot to say that currently, because of our limited supplies that we are getting, we are continuing to only perform testing on symptomatic patients. We've been unable to honor, people that wanted testing to return to work because we need to reserve those tests for the clinically relevant decisions that need to be made. We use the test, for example, for inpatients before they're going to surgery to know their status. We use it for determining which of our ICUs they go to. We have 2 ICUs here, and we've denoted one to essentially be our COVID ICU. So we need a number of those things. Obviously, laboring patients, we need to know the status of those patients. We also reserve some of those tests for healthcare workers. We need to keep our ability to provide services for those COVID patients up. So when our healthcare employees get sick, we use those tests. Hopefully, we have been in touch with the state, who is ramping up their ability to do further testing. We did hear from them yesterday about possibly being a site where testing could be done through state-supplied supplies to the general public. And we will, once we have that up and running, if we are selected to do that, we will certainly let the public know, and that'll hopefully be able to cover more people as tests are requested. Next slide, please. What we can tell you about our tests, you can see if going from the bottom to the top of that picture are the tests that have been done. You can see that we were doing it back before April 5th. It was every day, Monday, Wednesday, Friday. We were doing a lot of tests. The number of tests that we're doing has dropped off as the disease has gotten less prevalent in the area. The orange is the number in process. So you can see just the other day on Monday, we did a large number of tests, which as of yesterday morning had not come back. We're having about 22% of those positive, so we're still testing a lot of people that are negative. In fact, that's the majority, obviously, and we're averaging about 270 of those tests per week. Next slide, that may be my last one. That is my last one. And with that, we'll move on to Jeff Gyro.
All right, guys. Thank you so much, Dr. Pelche. So next we're going to hear from Dr. Jeffrey Gyro, and Jeff serves as the Chief Human Resources Officer, meaning he oversees North Oaks Health System's benefits and compensation plans, employee relations, employee wellness, workers' compensation, and system education. He also administers the system's volunteer services and North Oaks Foundation. Jeff joined the North Oaks team in 1991 as a registered nurse on the telemetry unit. He has served in a variety of clinical and administrative positions, including as education director. He has been recognized for his leadership and compassion by coworkers and was the 2007 Leader of the Year. He is certified as a Senior Professional of Human Resources, awarded by the Human Resources Certification Institute. He is also a Senior Certified Professional with the Society for Human Resources Management. Jeff, I'll turn it over to you.
Thank you, Rick. And I'll wait for Melissa to bring up my slides. As she's doing that, part of my responsibilities during our COVID response for the last month and a half has been mainly wellness, as Rick shared. The wellness department reports to me, so I was responsible for making sure that staff that had any possible symptoms were not at work appropriately and then returned to work as quickly as possible, as well as all of our visitor screening and maintenance of our staff, screening of our staff returning to work on each shift. So I'll start by saying this. We were on a conference call about a week and a half ago, a national conference call with major hospitals from New York, one from New Orleans talking, and they described, as you guys consider reopening your business, whatever phase that is, whether you're already open curbside and fixing to go larger, or you're not open at all and fixing to reopen your doors. It's been like tidal waves in healthcare, and you will feel the same impact as you reopen. Waves of emotions from your employees or potential employees, wave of emotions from your customers that you're going to have to be prepared to deal with. And so hopefully in the next few minutes, I'll give you some examples of some things that you need to consider in advance to make that easier for you and hopefully predict some of that. I'll say one of the biggest things is before you even start is human capital management. So if you're currently not open and have to re-employ a workforce, statistically, you would think at the unemployment rate, that would be the easiest thing to do. But consider, as Dr. Pelche started this conversation, in general, a lot of people are currently scared to interact with other members of our society. So people that have availed themselves to unemployment benefits that are probably more robust than ever, have state and federal match. They're going to be hesitant to leave that comfort to go back into the workforce potentially. And considering your pay practices, sometimes that may actually be a disadvantage. And a lot of employers, and you see it on the national news and in local news, a lot of employers are having to deal with that. A lot of restaurateurs have waiters that, considering could possibly make more on unemployment. So think through that as you start to rebuild your workforce, and hopefully you've maintained touch as much as possible to keep them engaged with you as you open your doors. But once that happens, Melissa, if you go to the next slide, you've got to keep them on the job. And that's what we've tried to stay on top of from day one. So it starts with an employee education model. You've got to make sure your employees are educated on when they should not report to work at all. And some of these things are, if they ever have any of the symptoms of COVID-19, and you can see those listed here, whether they have a fever of 100.5 or anything close to that, any active or persistent cough that's gotten worse, headaches, fatigue, shortness of breath, the GI symptoms, which at first were not as prevalent, we're seeing those now. And we've seen and heard of quite a lot of people, especially younger members of our society, complaining of loss of sense of taste and smell. Should they have those symptoms, I'll tell you at the end of my presentation what they should do before coming to work. You don't want them showing up and potentially impacting your other employees as well as your customers. And likewise, if they've had close contact with somebody else with symptoms of or testing positive for COVID-19, where social distancing was questionable. Example would be maybe their spouse has symptoms and now has tested positive, or a child that's in their home. You want to contain that. Next slide, please. I'm going to defer to Amanda. Rob said it best. Amanda's probably the most important person in this presentation, but these are the top three, and you've heard it from the president, you've heard it from the governor, you've heard it from Coach Ogeron in multiple commercials, and I copied from the CDC a simple poster, but these are all over the web. You've got to teach proper hand washing techniques, proper masking techniques when required, which we know they will be, and then covering their cough. I guess my biggest alarm here, until Amanda tells you the how, when, why, where, etc., is I think we're all going to be living in glass houses for a while. This has always been important, especially in restaurants and other healthcare environments, etc. But as the community comes into our businesses, they're certainly going to be very cautious in watching our interactions or the interactions of our employees to make sure that these things are happening. Are they washing their hands when they leave the restroom? If they walk up to a counter and somebody has a mask on that's just above their lip, they will know by watching TV that that's not appropriate. And certainly we may make their choice later in which business they will return to and how they share their experience. So we want to make sure we educate our employees on all the appropriateness of these three things, as well as social distancing, which we'll cover shortly. Next slide. This is just another example, and I only wanted to say here, there's tons of resources there as you begin educating your employees. Amanda will share some of those at the end and has a toolkit she'll speak to, but the internet is full of them. YouTube, their CDC has videos on hand washing techniques and masking, etc. So certainly you will have the ability to get plenty of resources for your staff as you rebuild that workforce. Next slide. Now let's talk about opening. Once you're open, and what we're doing on a daily basis is we're making sure, even though we've educated our employees on when to and when not to report to work, we've got to make sure that we're doing a check at the door before they enter our business to make sure they're safe to be here. So we have tables, and we've locked down our system where everybody enters and exits through just a few doors. And we have teams waiting for them, and we're questioning about symptoms of COVID-19. All of our customers as well. May not be the case in your business as long as they're masking, but we do in ours. The biggest thing is a temperature check. We want to make sure that we validate that our employees are not arriving to work with any type of temperature. We do that with infrared, so we don't have any type of invasive procedure, and we would encourage you to do the same. But please remember, if that's not possible, those are kind of hard to find if you don't already have them on board. You've got to make sure you have look at the manufacturer's guidelines to make sure you're appropriately disinfecting the thermometers between use, and that you're not potentially spreading from employee to employee, trying to be safe and screening before they return or come on their shift. My question is depending on your type of business, if you're running a 24/7 shop, is somebody assigned each shift to do that? Who's screening the screener? So if that's a manager or a supervisor that's on the floor, it's somebody asking those same questions, making sure they do the temp check as well, and then all your disinfection processes. Next slide, please. Workplace surveillance. So everybody's on the shift and they're safe. You've got to have some type of surveillance mechanism in place where you, the owner, or you're assigning managers to walk the floors and make sure that everything that you have prepared for is in place and working appropriately. And so I gave a few of the top 5 I've found in my research and what I see us doing here at North Oaks. Our employees using proper social distancing techniques from each other and their customers. Monitor masking, we just talked about there. Are they properly wearing their masking? Are they washing their hands when they should? Making sure signage is in place and getting all the tools available to you in place so your customer base feels safe. Hand washing techniques we talked about. and installing barriers where possible. In the businesses I've been frequenting, grocery stores, you see plexiglass going up between you and the cashier. I think all those things are great. I saw today in an area where there were markers on the floor. If you have any place where people may form a line, do you have tape or some type of marker where they know what 6 feet look like, and to make sure they're not getting too close to each other? Next slide, please. And I saw this on the Greater Hammond Chamber's website, or actually for this course, opensafely.la.gov. I've gone there and did some research. It's a wonderful resource for you. I would encourage you to do that, register your business, and you can see here on my slide all what you can expect, when you should fully open your business, the steps to do that, changes expected, what restrictions you should have in place. The most important for me, though, were the sanitation requirements, and then lastly, what type of PPE your staff should have in place, personal protective equipment. On my earlier slide, I said not N95 masks, because you've heard loud and clear on the news that should be safe for healthcare providers and first responders, but I received a call yesterday from a dentist. Absolutely, N95 masks, healthcare. So making sure that the appropriate masks are worn, gloves are worn, and Amanda will dive into that. I would absolutely encourage everybody to go to the Centers for Disease Control and Prevention, the CDC's website. It's littered with great information that you can find to protect your business and your employees. Next slide. And then lastly, from my perspective, we're here to partner with you to make sure that you re-engage in your business line safely, and that extension 2778 or 985-230-2778. We're here to help you. And so simply by calling that extension, anyone, so your employees or you can call that extension, be screened for potential symptoms of COVID, be set up with a telemed visit with a provider to see if testing should be ordered. And if testing's ordered, we also have primary care providers that can work with your staff to make sure that they return to work when appropriate and when safe to do so, as not to pass the virus to your other coworkers or your employees or the public that's entering your place of business. So with that being said, I will end my presentation and turn it back to Rick.
Okay, and I'd like to point out, if anybody has any questions that they would like to get answered, please click the Q&A button and type that in, and we'll make sure we definitely get those answered for you. And obviously, we saved the best for last, so we're anxious to hear what Amanda has to say. So Amanda Morse joined North Oaks Health System in 2005 as a registered nurse, and she assumed the critical role of infection prevention manager in 2015. During North Oaks COVID-19 response, her primary role has been in pandemic preparedness, infection control, and process risk mitigation related to the health system's operations for ancillary frontline providers and caregivers. She has provided education and competency verification for employees and hands-on guidance for both infection control and prevention of COVID-19. Amanda is board certified in infection control and epidemiology and is a member of the Association for Professionals in Infection Control and Epidemiology. She currently serves on the board of directors for Apex Greater New Orleans chapter. So we will turn it over to Amanda.
Thank you, Rick. Appreciate that. I do want to say that the concept of infection prevention is very abstract and very foreign to most people. But what is good about that is that we can pull out some foundational basics that apply to everybody and in every setting, which is what we want to do too. And I'm excited to be able to partner with our community to do that. You can go ahead and go to my first slide. So hand hygiene. The first thing I want to tell you is that hand hygiene is the #1 thing that we can do to prevent the spread of any disease. And it is something that we learn at a very young age, and it's ingrained to us that it's important, but we don't do very well in general. So in our businesses and in social areas in the community and in whatever setting you're in that this may help you with, I would recommend that you have available to both your staff and your customers soap and water or a hand sanitizing gel, easy, accessible for those people. And then I would also recommend that you place signage to remind people to do hand hygiene, and your customers too. They will appreciate that. The easy direction to give is to wash your hands frequently. But I think that we need to talk about the when of hand hygiene, because most people will walk around thinking they have clean hands, and it really is not the case. So the very obvious times for hand hygiene are after toileting and before eating, right? Those are very obvious ones. But some ones that we might not think about so much is after we're coughing or sneezing or just itching your nose, person-to-person contact, hand shaking, or sharing office supplies or equipment, sharing pens or keyboards. There's also a very, very important step of this, and that is how you do hand hygiene. I sat back a little bit so I could show you. We're very good, I guess, at washing the palm-to-palm part of our hands, but there also are the back sides of our hands should be washed, our wrists, the inner webbing between your fingers, and then also your nail beds as well. And then hand hygiene is not complete until your hands are actually dry. So you want to make sure the best thing to provide for people is disposable paper towels. The worst thing for people to do is to wipe them on their clothes and to dry them on their clothes. Hand gel needs to actually air dry so that it's on your hands long enough to kill those germs. I put monitoring compliance on the slide here. Basically, we want to make sure that people are actually doing it and doing it well. This will give you an opportunity to find where your education gaps are and also allay some fears of what we can do personally to protect ourselves and to protect other people. You want to discourage people from touching their face, okay? So your face is your main entry point for most germs and most disease processes, and your hands are dirty. So when you touch your face, you are directly exposing yourself. So go ahead and next slide, we'll skip from hand hygiene. Personal protective equipment, we call this PPE. And this is provides a barrier for your skin and for your clothes. PPE should be provided and worn with a consideration for the type of exposure you or your staff will encounter. So in most settings, this will be a facial covering or a mask, and in some situations, gloves. They are a correct way to put them on and to take them off. And actually taking it off is where most people will actually expose themselves to the dirty side of the PPE and cause harm that they're not realizing they're doing. So you really have to be mindful of these practices. CDC has a lot of resources, as Jeff mentioned, and some education materials to show people step-by-step how to do this safely. On the slide, I listed some do's and don'ts of PPE use. You do want to wear your mask or your facial covering to fully cover your nose and your mouth, and you want to leave it in place during the time that you're wearing it. You don't want to adjust it or touch it very often. You don't want to pull it down onto your chin. I call this bearding it because it looks like a beard. And you don't want to remove it and place it onto any surfaces, okay? Once you take it off, it should be directly discarded into the trash or put into the laundry to be cleaned. Putting it on a surface is a twofold issue. One, it contaminates the surface from your respiratory secretion, from your germs. And then secondly, whatever is on that surface is then being transferred onto the mask, and then you go and put it on your face, and we already talked about your face being your main portal of entry. So it's risky business to do that. I would discourage gloves in a community setting unless they're needed for a specific task. There is a greater risk, really, of disease transmission when gloves are universally worn, because people are less likely to wash their hands or clean the surfaces because they're on a false assumption that they're protected, because they are protected by the gloves. So you also want to wear gloves when you are wearing them for a single task and then discard them afterwards. An example, I was thinking food service. When you're picking up non-disposable food service items such as plates or glasses, utensils, of course you want to wear gloves for that situation. But as soon as you're finished with that task, you would discard them and then perform hand hygiene. You certainly don't want to continuously wear them from task to task because you risk contaminating those other environmental surfaces around you. And then you don't want to wash your hands or wash the gloves as if you were washing your hands as well. Now, I know that this process maybe have been adopted out of necessity for PPE availability at this time, but I would really caution against it because there is a risk that you, number one, are not cleaning your hands very well, or number two, you're affecting the integrity of that glove and therefore not protecting yourself anyway. So I really caution against gloves in the community setting unless they really are necessary. You can go to the next slide. Moving on to cleaning and disinfecting environmental surfaces. So in general, a daily cleaning of all your work areas is a good time frame. But you do want to identify high-touch areas. So in your own setting, so in every setting there are high-touch areas. Some examples of that, because they're frequently touched areas: doorknobs and handles, countertops, desktops, elevator buttons, kiosk or screens that you would be using. And then of course I've been talking about shared office equipment, pens and such, and then keyboards and registers or something. You want to clean those areas more often, ideally between uses, and that's not always feasible. So I recommend coming up with some kind of cleaning schedule or some kind of a plan that involves everyone. The more surfaces that are cleaned, keep this in mind, the more surfaces that are cleaned, the decreased amount of germs on those surfaces then in turn decreases your risk to everybody. So the more we clean, the better for everybody. I'm going to move to products for disinfection. So you want it to be an EPA approved disinfectant. I did include a link to the registry for that at the end of the slide deck. And the main importance here is that you follow the manufacturer's instructions for use on any disinfectant that you choose, okay? You want to particularly look for something called a contact time or a kill time. And this is the time frame that a disinfectant has to stay on the surface wet in order to kill the pathogen that it's claiming to be able to do. You're also going to be looking for a virucidal or a bactericidal product, okay? So that's bacteria killing or virus killing product. And make sure that if it has to be diluted, you're mixing it appropriately, and then it's being stored and safely handled as well. Many businesses have involved their customers by providing disposable wipes to clean buggy handles or other point of use items. I think this is a very good concept. It is showing the public that you care about their safety, you're involving them, and everybody is working to the greater good of protecting each other. I also I suggest creating a cleaning schedule to ensure that all these areas are being cleaned. You want to instruct your staff to clean from a clean to dirty, in a clean to dirty process. An example of this, which would probably be a very good visual for most people, is if you were cleaning a restroom, you would want to clean the sinks and the countertops before you move to cleaning the toilet. And the principle behind this is that you don't want to spread germs from a higher contamination, an area that is higher soiled, to an area of less contamination. It's a good mindset to have cleaning in any setting. We certainly use it in healthcare. And don't forget that hand hygiene is the most important part of anybody cleaning and disinfecting. They need to be doing their hand hygiene. You can move to the next slide for me. Social distancing, Jeff went over this pretty good. I just wanted to highlight a little bit, just being very mindful of the proximity in your public areas or what you're typically working in, your workspaces. If people are typically working around a table or in close proximity, space them out, pull out some of the chairs and give them less options of that. Jeff mentioned signage and traffic flow directions, and that's really great, or barriers, which I think most people are using now, and they're very beneficial. So my last slide is this infection prevention community toolkit and resources. Everything that I've said, it will be mirrored in the CDC. I included some links for you. I do encourage you to get on the CDC and look around. It's very easily operated, and you can get education tools that you can print out and use as resources, and it'll be a great resource for you as you're starting back up. So I'll have, thank you.
All right, thank you so much. I'm going to lead us through some questions, and we will let our North Oaks team answer as they will. The first one, I'll actually chime in and then let North Oaks go. Where can you get masks locally? I will say to our business friends that we did reach out to our Tangipahoa Parish government and Tangipahoa Parish President Robbie Miller was gracious to provide many thousands of masks from the Haynes donation for us to distribute. I know that here at our office, Seth Blakely and myself have already contacted and distributed more than 170 businesses have secured those masks. We do have a few more. That alone was over 3,500 masks. Ponchatoula Chamber and Amite Chamber, we did make sure they have 1,500 masks. So if your business is closer to one of those spaces, please just reach out to them. If not, give us a call here, 985-345-4457. And we do ask that you simply ask for as many for your employees to give you a starter set. Most people we talked to said that their mask would arrive in anywhere between 7 days and 2 weeks. So we want to get you started. All right, so the question is, mask locally. Is there any other recommendation you all have for securing masks?
Yeah, supply chain has been a significant issue, both for the hospital and I'm sure for all of you. We understand that we've seen businesses get involved in getting those masks, and I can see the Q&A, and I'm going to answer a couple of the questions that are in here while I've got the mic. But we, it's put us all competing against each other for the mask. We use the mask here to protect all of our fellow employees from us. So remember, the mask that you're wearing, an N95 mask, is for aerosolized procedures. So when we do an intubation, when we do an endoscopy, when we use high flow oxygen, all of those things, we may be aerosolizing the virus. That is the only setting where we've seen an N95 be a beneficial mask. The other masks, which we call isolation mask, are just the simple masks that wrap around the ear that are meant to protect us from when we cough and sneeze and have respiratory droplets come out of our mouth. When we're doing those, it stops them from occurring. So I see one of the other questions is about the cloth mask. Are they as good as the disposable mask? I have to say yes and no on that. The answer is they're probably just as effective as stopping that cough and sneeze. The benefit of the disposable mask is once you've coughed or sneezed on it, you throw it away, and you're not going to be touching something that may have soaked through, that once it's wet and it's soaked through, if you touch your face, we all do it on average of 15 to 17 times in an hour, unless we're conscious to not do it. When we touch that mask, especially in adjusting it to make it comfortable for us to breathe, we may inoculate our hands and subsequently touch something that could, pass on the virus to a customer, or in our case, a patient and or one of our other fellow healthcare workers. So yes, masks are very hard to get. We have noticed here at the hospital, they have become much easier in the past couple of weeks, the past 2 weeks especially, to have our supplies go up as the number of cases have dropped nationally and the hospitals aren't using them to the degree that we have been using them, and production is ramped up. I can't tell you where to get them locally. Obviously, there's a source through the government, but we all are competing with each other to get those masks through. But if the only thing you have is a cloth mask, it's absolutely appropriate for your workers, but it's important, as Amanda said, to have that, and Jeff too, that the mask is worn correctly. And I will tell you, just from a public perception, when I went to get milk on Saturday and I was at a local grocery store and I saw everybody with the mask way below their nose, yes, it was great that every employee had a mask on, but when you're not wearing it correctly, you might as well not be wearing the mask. So vigilance to go back and continue to remind your employees over and over that that's not the proper way to wear the mask. Listen, masks are not comfortable to wear. I know that I've, when it gets to August, breathing humid Louisiana air is not fun to start with. And then having to breathe it through that mask is not going to be a pleasant thing to do, but we got to continue to push our employees to wear those masks.
I will say that I included a link from CDC for do-it-yourself at home making mask a pattern if you were going to do cloth masks. And as far as the workforce, I would make sure that you remind your staff to keep it in place, like Dr. Pelletier said, and not and not adjust it and move it around, but also to make sure that they're laundering them at the end of the day. And so they're not wearing them several days in a row. They are getting home and putting it straight into the laundry.
All right, good information. I like this question here. Financial institutions are working through security scenarios of how to proper identify individuals to prevent fraud. Since many will be wearing masks, this makes identifying people difficult. Is it safe to ask an individual to briefly remove their mask if they are in a socially distant area, or should we request them to use our drive up to be identified?
Complex question. The answer is, I mean, if you need to identify somebody for security reasons, they can certainly back up and, you know, take their mask off and then redon it right after. I mean, as long as somebody's not coughing or sneezing at that one point, it's probably relatively safe. We don't want them to touch their mask, or we want them to touch their mask absolutely as little as possible. Because remember, as Amanda said, the hands are the problem. When we touch the mask is now considered dirty. But asking, you know, especially if you're able to have alcohol gel where they can gel their hands before they, you know, move their mask, that'll help, you know, in some aspects. But yeah, you should be able to, you know, identify somebody securely. And certainly from a security standpoint, if we have any question about who the person is, we're going to ask them to remove their mask and have a look at their entire face. So yeah, I think it is relatively safe to do that.
What about thermometers that y'all are recommending? Any particular information they should watch out for in searching for those thermometers?
Jeff?
Yeah, so the happiest day at North Oaks was the day our 15 infrared thermometers came in, so we could use them at all our entry points because we were doing orals before that. The issue with infrared, though, it's a temporal scan or a scan of the forehead, actually. When you do that, there's a lot of environmental factors. So if it's an extremely cool morning, you're doing it right at the door, your temps will run a little bit low. So you have to have a backup to that. If temperature is getting close to 100, you need to go to oral thermometer to make sure that that's an accurate temp. So that's what we recommend. Oral's obviously going to be the most accurate all the time. But if you can get your hands on infrared, that's certainly great for screening. And that's what we're using.
So if you do
add on to that, go ahead, Amanda.
Sorry. I was just going to say that if you are having to use the oral thermometers, it's fine to use them from person to person if you are appropriately disinfecting them between each use. And manufacturer will give you guidelines on that. But you want to make sure you're using a disinfectant that is going to be virucidal and bactericidal, like we talked about.
Yeah, you know, screening is multifaceted, and I would certainly, it's more than temperature. So although you're talking about a particular thermometer, we know from studies that patients, only about 40% of hospitalized patients on admit actually even had a temperature. So although you're going to catch relatively few patients or COVID positive people with the screening of a temperature, the fact that you're doing it obviously gives some confidence to the public that you're having some measures to do that. You will catch a few, but it also, even with your employees, there's a good chance that employees know if they're going to get screened and they are sick, they're more likely to call in and let you know, I'm not feeling well today. They're not going to take a chance at bringing in, you know, infecting their fellow employees if they know that they're going to be checked every day. But you need to ask about symptomatology too for everybody entering your building, especially your employees.
What about changing gloves between temperature checks, both infrared and oral? Recommendations there?
Go ahead, Amanda.
Sorry, not to bullshit. I would say for the infrared, if you're just doing the forehead scanning, it's probably less likely that the glove or the hand would be exposed to any germs. But if you were putting a oral thermometer into somebody's mouth, they are breathing out onto your hand. And yes, you should change your gloves in between and wash your hands in between people.
Thank you. Are there any precautions, in addition to those that you have mentioned, that y'all are doing at North Oaks that you might want us to know about?
Well, I mean, our biggest thing and the biggest thing for frustration with our patients has been the lack of visitors. We're trying to limit the amount of people coming into the facility. And although when you're running a business, you're trying to get people into your place of business, doing as much as you can to try to stop, one person coming in the business when, only the one person is necessary and not a family of 8 or 10 coming in. Anything you could try to do to limit those numbers coming in. The main purpose of our visitor policy is to prevent as little people coming into our facilities, just increase the social distancing as we possibly can, because, the people inside our facility are the most vulnerable people in the community. They're already sick, they already have a reason to be in the hospital. We're trying to bring anything from outside or keep anything from outside. So, no, the same things that we're telling you guys to do are the things that we've been doing here. There's nothing special that we're doing. We're wiping our surfaces down. We are checking people as they come in. In fact, a little later today, Michelle and I are doing a video so that the public can look at the actions that we're taking. And, y'all be able to see that in a day or so and mimic some of those things. But it's all the things that Amanda talked about, other things we're doing here. Nothing different than you guys are other than visitors.
Let me get that mute taken off there. Thank you for all that y'all are doing. We have one more question and then we'll throw it back to Rick. The question says, do you expect to see an uptick on cases later this fall once restrictions are relaxed?
Well, restrictions may be relaxed next week. So do we anticipate the cases to go up? Absolutely. I think every scientist out there understands that what I talked about has a number of different reasons that it can be affected. A virus needs to be able to transmit. So when we have herd immunity, and people have heard that term, herd immunity is when so many people have it that it just doesn't have anybody to infect. That influences. Now, unfortunately, with this disease, it looks like 60 to 70% of the population will have to have herd immunity prior to us seeing that infectivity of the disease go down. But everything we do, the social distancing, if I'm not next to someone, I can't get the virus from someone else. It's a human-to-human contact. So when we open up and more people are interacting, we expect to see some type of rise. Now, the Centers for Infectious Disease put out a report this past week looking at the 3 possible scenarios of this particular disease. And essentially, they saw that we would have peaks and valleys that are about equal to what we had a month ago. But a lot of them are pointing to the previous pandemics of influenzas, the last 8 pandemics we've had since 1700, as showing that in the fall, we tend to see a huge spike in viral illnesses, especially after the first spike of a novel illness. We are concerned that may happen, and we're going to be prepared. Luckily, we have a few months before that happens. It usually coincides with kids going back to school, and Dr. Jimmy Guidry, our Chief Medical Officer at LDH, is concerned about school. And when the kids return, they're the perfect vectors because they generally are asymptomatic and they're not as good at the hand hygiene and the other things we all know. We have to tell our kids to wash their hands at dinner every night. They forget. So we do have concerns that the fall will see a larger amount. It generally does with viral illnesses of this type. But we also don't know what even the next couple of months. Luckily, we have a couple of states that opened up earlier than we did and a couple of countries that have opened up earlier than we did. So we will be able to see the effects of how they minimized social distancing or relaxed social distancing and the clinical effect of that happening. So we have some experiments going on in China, Italy, Georgia, Mississippi, you name it. Everywhere we have those people that have opened up a little bit before us. So we should see the effects of that. So pay attention in about 21 to 28 days, what our numbers look like, and that'll tell you a lot about where this virus will go over the summer.
Thank you. I've marked that date on my calendar. I want to thank North Oaks again. To our chairman, Rick Sedberry, we're ready for you to come back.
All right, guys. I'd also like to, give a huge shout out to North Oaks and thank y'all so much for putting this on. It was very informative, very educational. We also thank you for your leadership in our community and, of course, being a premier level sponsor of the Greater Hammond Chamber. So thanks again. I'd also like to thank everyone who attended today. We really appreciate you jumping on and joining us and investing your time, not only in the community, but also investing as being a part of the Greater Hammond Chamber. So y'all have a great rest of your day, and we will see y'all again soon, hopefully sooner than later.